I've had a lot of trouble with my mental health since about 1982, in fact. Been in and out of Wellington Hospital several times. In the old days it was Porirua. It's a nightmare. My problem is it comes on really fast, and I have a lot of support people helping me out, but despite that I still get sick, which is a little bit disturbing. My warning sign is my sleep. If I don't get a good night's sleep, and that gets worse and worse, you end up getting no sleep at all, and of course no human being can cope with that. The hospital's about 10 minutes walk from here, so to that extent it's quite convenient. But of course you can't just bowl along to the mental ward and say, I need help. You've got to go through the system, and that involves waiting in emergency for a heck of a long time. You know the singer Morrissey? Yeah, he says Friday night in outpatients. There's a line from one of his songs. Friday night in outpatients, you know, down at the old emergency, you see some sights down there. Yeah, it really is, it's bizarre. And a lot of it is alcohol driven. I say every time I get out of hospital I'm never going back, just because it's such a nightmare. It's not the staff's fault or anything, and it's not even it's nobody's fault, but it's just that in there, everybody's out of their head. I come back here and I think, how stupid was I to go to hospital when I got all this? You know, like I'm completely independent, got everything I need here. You know, all my media sources and books, records, CDs these days, or not even CDs, is it? I've had a lot of jobs in my life, both in the media and in the government. The trouble is that I get into the job and I'm going along there and really doing my best. Then all of a sudden I run into my problem. They used to have a thing called the day hospital, which you just go in for the day and do the activities, like the arts and crafts and music and stuff like that, which was really good. But they don't have that anymore. They decided that was not a good idea. I think it's probably true of everybody who has mental illness, is that the one thing you can't really do is cut yourself off. You have to stay in the community. And I guess that's what they're thinking with closing some of these places, is that it's better to have the mental health treated in the community rather than have special areas set aside, you know what I mean? I go to a couple of coffee groups, and so we'll bowl down to Baobab and Cafe in Newtown on a Tuesday afternoon and just meet up for a coffee, just talk about whatever we want to talk about. The thing is that if you can give people things to do, you're not going to have the same kind of problems. So there's always the possibility I'll end up back in hospital, but at the moment I'm on top of things, so I'm always optimistic that I'm going to beat it.